Coelho.
Thank you. Good day. My name is Dr. Ramona Coelho, and I'm a family physician who works in the margins. By that, I mean in Montreal, I was a home care physician who took care of disabled and ill people who were homebound. And here in London, Ontario, my practice is comprised largely of people living with disabilities or chronic diseases, many refugees, men out of prison. Given my practice, I am here to say that this bill does not protect my patients from transient suicidal ideations, and it needs amendment. I'd like to point out, as a separate point, the limitations of the 2019 Health Canada report on MAID. The information was self-reported by MAID providers, so unlikely to uncover abuses. Canadian evidence can say nothing about MAID outside of end-of-life context, and so will not tell us what will happen when Bill C-7 is enacted. The information is pre-pandemic, and COVID has affected vulnerable communities by furthering financial difficulties, limiting social supports, as well as increasing isolation. I'm sorry, someone has to mute their screen. Besides which, a new article in the Canadian Journal of Bioethics concludes that oversight of MAID has been inadequate. Monroe et al. Published a study this month that palliative care access is much lower than was reported in the Health Canada report. And abuses of MAID legislation are outlined in the April 2020 World Medical Journal by Herx et al. And the Vulnerable Persons Standard Report. There are document cases of abuses of law and policy by the Chief Coroner of Ontario, the End of Life Care Commission in Quebec, and very recently, the Correctional Investigator of Canada. Back to the reality on the margins and my patients who can now access MAID within 90 days. Pain clinics, psychiatry, rheumatology, neurology, they all take longer than 90 days to initiate a meeting, educate, decide on therapies, and find symptom resolution. Death wishes are often transient, and they peak at 3 months, and they wane by 24 months in patients with chronic illness. We should not be facilitating suicide through MAID when offering resources would have let these people go on to enjoy a good life. Christine Cowley is a person who had a spinal cord injury 33 years ago. Since her injury, she has a doctorate, is a professor, is a wheelchair track Paralympian. She's married. She's had 3 children, all post-accident. Let the ableists in the room listen. But Chris shared that it took her years after her spinal cord injury to feel great in the morning. She had to live in community and integrate to feel healed. She shared that if someone had suggested MAID to her in her early years, she may not be here today. Dr. Karen Ethans, a physiatrist from the University of Manitoba, shared that many doctors who work in acute care settings have no understanding of the lives of people with spinal cord injuries. And many times these doctors have communicated their biases to the patient before she's got involved. She also said that early on, many patients are suicidal, but by 2 years, they rate their quality of life as quite high. In fact, many higher than the non-disabled population. She says, permitting eligibility for MAID in early periods when they are vulnerable is a failure to understand medical evidence. As I shared, my patients have disabilities and a high prevalence of illness. When you're faced with loss of function, denied essential supports, living in poverty, things could be overwhelming for all of us. There is a subtle kind of coercion that can take advantage of such a patient's state, signaling to them that they are better off dead. Spring Haas, a lady who has a spinal cord injury for 15 years, has publicly stated, as disabled people, we are conditioned to view ourselves as burdensome. We are taught to apologize for our existence and be grateful for the tolerance shown to us. We are often shown that our lives are worth less than non-disabled lives. Our lives and our survival depend on our agreeableness. A choice to die isn't a free choice when life depends on compliance and good behaviors and with societal norms. And sadly, the medical community can be complicit in this messaging. In that story I shared before of spinal cord injuries, what Karen Ethans was saying is that many doctors have already instilled that idea of hopelessness in those people who've just had motor vehicle or other injuries. Gabrielle Peters, a brilliant writer who has struggled with poverty since her disability, has shared that a healthcare professional sat on her bed. Her husband had just left her for her disability, and she was newly bedbound, and urged her to consider death. We heard in the Justice Committee similar stories by Roger Foley and Taylor Hyatt. I conclude with sharing the words of Dr. Thomas Fung. His Indigenous populations struggle with the same negative social determinants that mine do. He stated, assisted death should only be an option of last resort, not the path of least resistance for the vulnerable and disadvantaged. MAID needs to be a patient-initiated discussion to avoid subtle coercion, and MAID should remain a last resort. I ask for these amendments in the bill. Thank you.